in the month of March. So the situation has been pretty stable, as I say. On most days, the number of cases of COVID, the number of new cases that we have identified has been less than 10. All right, and we continue to see this low-level transmission occurring in the population. So it's just a reminder that we are not completely out of the woods, but we are in a much better place than where we were some weeks ago. Of course, we would like to maintain those gains. So, of course, we encourage the public to continue to exercise care and attention in everything that they do. Now, one of the important ways to ensure that we mitigate or we lessen the severity of this situation is vaccination. As it stands, we are at a third of the population, so around 33% of the population, who have been fully vaccinated, meaning that they've received their first and second shot of the vaccine. We have another 4.8% who are partially vaccinated, and around 5.2% of the population that have had a third dose or a booster shot. We have ample supply of vaccines available to the public, and we continue to encourage persons because vaccines have been proven to be effective at controlling, all right, this pandemic and at limiting the pressures on our hospital system, on our healthcare system. So we continue to encourage persons to come forward and get vaccinated, and there's still time, all right? There is still time to get the shot. This is the main part of the outbreak as it relates to COVID, but what we want to remind the public that while we are in a very good place right now, all right, we want to remind everyone that the pandemic is not finished. The pandemic is not over, all right? This morning we see that there are upsurges in cases in Europe, and well, particularly in Asia and in some regions in Europe. So it's just a reminder to us that we should always keep our eyes open and to continue to conduct ourselves in a manner that would ensure that we remain safe. So I'll pause there for now. Thank you.
Thank you very much, Dr. Sean Charles. So we hand over now to the Honourable Minister for Health, Nicholas Steve. Good morning, sir.
Thank you, and good morning. Thank you, and good morning to all of your viewers and listeners out there. Welcome back as well to our Chief Medical Officer, Dr. Sean Charles, after well-deserved rest and relaxation, I hope. You have heard the update and information that our CMO has given, and many of you have been following anyway, internationally, regionally, and locally on the current trends. We have come a long way, and we have come this far in particular because of the sacrifice that many of us have made and the adjustments that many of us, if not all of us, have made for the better good. Based on the global situation, we have always adjusted and preempted as best as possible. We have strengthened our health systems, for example. We have strengthened our testing ability very early in this pandemic. We made sure that we had the required medications here. We strengthened our health team with the assistance from countries like Cuba. We made sure that the ancillary supplies like oxygen were here. And then, of course, we made sure that vaccines are available and continue to be available for any and everyone who, based on age, is eligible. There are more vaccines than demand and have been since early last year. We must move on. And the global picture that we see, the picture that our CMO has painted, indicates that it's possible, that the time is right to contemplate that moving on, that getting back to some form of normality. And at present, the only restrictions that remain in, one, the state of emergency, two, what I refer to as our vaccine differentiation, where we treat certain situations differently depending on whether someone is vaccinated or not vaccinated, and the mask mandates. And as such, it has been discussed and information provided. Cabinet met yesterday and made a decision that if the current trends continue, if the picture that we are seeing continues to be the reality, that we believe that on April 4th, by April 4th, the first Monday of April, the final bits of restrictions that I've just mentioned can be and should be removed. Vaccine differentiation and mask mandate and any restrictions with respect to gatherings related to the spread of COVID-19. That is our sincere hope that this will happen. Like everything else, it is up to us to ensure there is a certain amount that is dependent on what happens elsewhere, but it is up to us. We will continue to monitor and analyze between now and then, and even after that, monitor and analyze the situation locally, regionally, and globally, and adjust accordingly. But Cabinet does believe, based on information received and consultation with our various national, regional, and international partners, that on April 4th, the vaccine differentiation and mask mandates can be removed. That is saying that they're only fully vaccinated events, or they're places that only vaccinated persons can enter, etc. However, let me be very clear on this. Like every other place that is private, the management or owners of those places have a right to dictate the conditions for entry. We're very much aware of places where persons say you must wear a shirt, full shirt, or you must wear shoes, etc., and so to enter. We respect and would not interfere with any institution or any private establishment saying that they still would want to have, in the interest of their patrons or their employees or those who are there, their members, that you must be vaccinated to enter. That would be the right of the individual to insist on that. So whether it is a private institution, office, bar, restaurant, school, church, home for the aged, those entities still have the right, and we respect that because, as Dr. Charles has said, we're not out of the pandemic. We're trying to get to that new norm with the pandemic. There are still certain good practices that I do hope remain. For instance, sanitizing of hands on entry, I think, is a good practice that we should keep with or without COVID. It can prevent so many other infectious diseases or contagious diseases. Mask wearing for vulnerable individuals when in public or persons who are experiencing symptoms of some form or other should be something that we could look at as holding on to, not as a law, but as a good practice. Vaccinations within the hospitality sector as well for the various contagious diseases where vaccines are available, I think, is a very good practice that should be maintained. What we need to recognize as well is our health systems. Our health systems right now have never been stronger. But because we have been spending so much time focused on COVID-19, we now need to pivot and focus on the areas that have been ignored or have not received the attention because of resources, limited resources had to be directed to COVID-19. So I speak specifically to the non-communicable diseases, diabetes, hypertension, we have cancer, oncology, the treatments of these non-communicable diseases. So dialysis, oncology, our very own A&E, because we still remain vulnerable. We still remain vulnerable. Recognize this. We are saying, as Ministry of Health, that while we endorse and we support and we lead this charge to going back to normal, we also remain vulnerable. And it is that balance that we have consistently spoken about between life and livelihood that now necessitates this new step, which we look forward to entering together with you all on the 4th of April, the first Monday of April. Thank you.
Thank you very much, Honourable Minister. So, colleagues, you've heard from the Honourable Minister as well as the Chief Medical Officer. Are you ready with your questions? We want to say good morning to all those who are in attendance so far. MTV, Nancy Maguire, Nisha Paul, GBN, good morning. Anybody's ready with their questions? GBN, good morning.
Hi, good morning. Just for clarification, the Minister would have highlighted April 1st regulations, no mask potentially, as well as in terms of restrictions for vaccinated, the segregation between vaccinated and unvaccinated. Just for clarity, in terms of the state of emergency, would it still remain in effect, or is it something that government is continuing to consider?
No, the state of emergency only remains to date to assist in the enforcement of these regulations. They exist within the state of emergency and as well as the Public Health Act. So no, the intention is between now and the 4th of April that the state of emergency would be removed by the Governor General. That as I said, the vaccine differentiation for entering Grenada as well as entering places in Grenada would be removed, and the mask mandate as well.
Any other question, Gerard?
Yes, I have. In regards to the whole situation, though everything is the trends are looking good, many are still concerned that the Ministry of Health has stopped the issuance of the COVID-19 dashboard. People want to have knowledge of what's going on. What is the rationale for that move? And I have two other questions related to the dialysis unit. It was expected to be launched on March 10th. The date has passed. Any updates there? And have a fee structure been developed? Because people who, as the Ministry of Health have cited, affordability is a major issue. People want maybe a cheaper fees for dialysis. Has that fee structure been reached?
Maybe I can let the CMO address your first part of your questions, and I'll address the other two afterwards.
With regards to the dashboard, we have not discontinued the preparation of the dashboard. In all honesty, on many of the days, the information, there's barely any change, simply because the number of cases that are being reported are very, very small. The number of persons coming forward to get vaccinations are very, very small. So there's very little change. So what we are looking at now is maybe issuing the dashboard with less frequency. You may not see it daily, but you may see it twice a week. Because like I say, the data reported on it, there's hardly any change from day to day. I can answer the first part of the question with regards to dialysis. There was a slight delay. There was a slight delay, and this was created as a result of the results of the analysis that was conducted on the water and the additional tests that needs to be done. and the fact that we need water at a higher pressure to be delivered to the unit. So we are right now awaiting on an additional connection of water to the unit that will ensure that the water pressure delivered is high enough to ensure that the machines function optimally.
Yeah, with respect to the second part of that, yes, we have worked with the existing stakeholders, so the Kidney Foundation, the Ministry of Social Development, as well as Ministry of Health and Island Health Systems, to put together a fee structure that in our opinion is affordable and sustainable. It does result in a significant decrease to what persons would have been paying before the commissioning of our dialysis center. But there is a cost nonetheless for dialysis as we move forward. That fee structure will be made available to the individuals who require dialysis and to individuals who are visiting who may need dialysis as well, as part of the general overall hospital fee structures for any and all of the services offered at the general hospital. Just to go back to the first part of the question, that quite possibly, yes, we were overly enthusiastic, recognizing the need to get people onto dialysis, that we put a very ambitious opening date. But apart from doing that, we also put in place systems to ensure that the quality of care was guaranteed. And as such, in the final tests, we recognize that, as Dr. Charles says, the water pressure needed to be increased to guarantee quality of care throughout, and those adjustments are being made as quickly as possible for the final commissioning of the dialysis unit.
Thank you, Jared. Nancy McGuire, good morning.
Good morning, and good morning to everybody. I'm wondering if in terms of our testing that we're doing, is it just the Omicron variant that we have in Grenada? Because the last time we checked, there was one Delta. And then the considerations for Cabinet observing things between now and April 4th, there already is evidence in some countries that the number of COVID cases is increasing in China and elsewhere. So I'm wondering what it would take for Cabinet to not go with April 4th. Have you got some sort of formula, or how are you doing that? And then the other thing about not having that much information to report on the dashboard, if we're not doing that much contact tracing, has there been any consideration of testing the sewage like they do in other countries that can give you some indication if COVID is still around and to what extent? Thank you very much.
So let me say that the last detection of Delta that we had was sometime early in December. I believe it was the first week of December. All subsequent sequencing runs showed that Omicron was the variant that was circulating. All right, so that is basically the information I have on that one. With regards to testing and testing of sewage, now we still encourage everyone, anyone with flu symptoms or anyone who has been in contact with a positive case, when the time arrives, that they should come out and get testing, because testing is still available at all of our health facilities. And we generally do upwards of 200 plus tests daily, on average, upwards of 200 tests daily. Now, with regards to testing of sewage, yes, that will be helpful. However, two things we must bear in mind. One, we do not have central sewage systems that are representative of the country. For example, I am aware that there is one in the south, It will not necessarily be representative of the population, and two, we would need to develop the expertise and partner with the agencies that can assist us in the proper collection of samples for testing and so on. All right, so it will not be practical to implement a modality such as that at this time, because we do not have central sewer system that serves a greater part of the population. I would say over 90% of the population, they're not connected to a central sewer. They have their individual isolated septic systems at home. Thanks.
Yeah, Nancy, with respect to the various triggers, also what we're monitoring and what you may have been observing, for instance, in China as well as certain European countries or so. We are also very much aware of that. What we continue to monitor is not just the number of cases, but we continue to monitor the number of hospitalizations and deaths associated with any increase in COVID-19 cases anywhere in the world, which would be the first indicator of possibly a new variant or so. So if you look at the bigger picture with China, you will see that China managed to avoid the Omicron wave to date and is now experiencing regrettably their Omicron rate. I'm not on the ground there, we're not on the ground there, but their health officials are making the necessary decisions and taking the necessary measures to control or control as best as possible. But you really do need to look at the bigger, over the last 3 months, 4 months of China to get an assessment as to where they are right now in this global pandemic, similarly with Europe. But yes, the reason that we have made an announcement of a future date, one is that we see that is a direction that we can aim towards and steer towards with respect to our restrictions with COVID-19. But as I clearly said, we continue to monitor between now and then and even afterwards what the global picture is. And as the CMO clearly said, we are not out of the pandemic, but we are in a phase of the pandemic where we can get back to some form of normality. But we must always recognize that our low level of vaccinations and the fact that we are a developing nation still continues to have us at a certain level of vulnerability.
Any other from you, Nancy?
Yes, I'm thinking on the 200 plus tests that we do daily. Are these random, or how are these done? And the other thing is, there are people out in the community with sneezing and thinking that it's not COVID or it's just a mild case of Omicron. How are we going to keep track of that? That's just my concern. I'm not doubting there's lots of testing going on. I'm just wondering how and where. Thank you again.
All right, so let me just say that any surveillance system anywhere will not pick up 100% of whatever condition that they are monitoring in the population. Because, I mean, there are several stages that we must think about. One, it will take someone who identifies that they possibly may have the condition, or let's say the infection. Then it will take the motivation of that individual to go visit a healthcare provider and possibly get screened. And then that healthcare provider actually making the diagnosis or thinking about the diagnosis and then requesting a test. And then from then, it is the accuracy of the test in picking up the condition if it's there, because we know based on the stage of the condition, you may or may not identify at that time. All right, and then we have the stage of reporting of that information into the surveillance system so that those individuals can be counted. So at many stages you can miss. So you will not identify all individuals. What we encourage is personal responsibility, because you will encounter scenarios where persons may very well have the disease, and if they choose not to get tested and they choose to expose others, then that is where the problem lies. But the thing is, we, as the Ministry of Health, as the government, we cannot continue to, continuously place restrictions on individuals to ensure that they make the right decisions. At some point, we have to say, yes, we have done as much as we can do, and it is up to the individual now to meet us halfway and to assist. So for all those individuals who may be walking around and thinking it's just a cold or so, we still encourage them to, come get tested, make sure that what you think it is what, is what it is. And, so that it would at least give us a better picture as to what is in circulation out there. So, that is how I can respond to that. And like I say, the testing, how it's done, the question was, is it random? This testing is across all health facilities that report into the healthcare system. So all public facilities report to the surveillance unit in the Ministry of Health. And a good representation of the private healthcare providers also report their testing data to the Ministry of Health. So it's a combination of both public sector testing and private sector testing that we put together and we report on a daily basis.
Yeah, Nancy, if I can add to that too, that it's similar almost everywhere else in the world. The same reference you're making to certain European countries seeing an increase in cases, and in China, etc., it is based on their health systems. It is based on random testing. It paints a picture. Our dashboard that we've been releasing throughout this pandemic is a snapshot. Epidemiologists, healthcare professionals, and even some of us at home, armchair statisticians and concerned citizens, have used that to analyze what the national situation is or was at any point in time. So we understood very clearly that a 20% positivity rate meant that 20% of our population could likely be infected, because 20% of the sample produced a certain level of positivity, or 3% or 2% or 1%, wherever it is. So we use that information to react and adjust accordingly, but it has never been and is not an exact science that you can say that we must put gates down throughout every parish or so and test everybody passing through so that we know what the situation is. No, that is not a practical solution to it. It is based on those who come forward to health centers for whatever other reason they may be coming there, and those who come forward to be tested because they suspect or believe that they have been exposed, and as most importantly, as Dr. Charles alluded to, it's based on personal responsibility.
Thank you. Thank you, Nancy. Nisha, good morning. Nisha, good morning. Are you there?
Hi, good morning, everyone. Are you hearing me?
Yes, go right ahead.
Okay, my first question, how have we, the ministry, documented the lessons learned from the pandemic, and how has this contributed to the decision or the considerations to now remove the restrictions in April, taking into consideration the challenges that were experienced in health, the delivery of health, hospital services, and education, and how prepared are we to deal with another outbreak if that happens, God forbid? And my second question, can you provide an update on the ethics committee that was announced recently? Thank you.
If I can, in terms of how prepared, when we entered this, we didn't have any rule book. No one in the world did. There was no roadmap, there was no rule book. We wrote one here, and almost every country, if not every country, wrote one, and the WHO and our own regional CARFA, etc. We have never been as strong as we are now with respect to the ability to deal with a pandemic, with respect to our ability to deal with a mass infection situation. And we continue to strengthen, even though we believe that we are on the downside and hopefully at the end of this pandemic. Last week, in collaboration with the US government as well as Southern Command, we commissioned 2 field hospitals, 40-bed field hospitals, which are in respect to our ability to deal with a mass casualty event or a mass infectious event. So we continue to grow from strength to strength on this, and at the same time dealing with the non-communicable diseases. Why do we have a dialysis system? There is a link. We are seeing, like elsewhere in the world, a correlation between persons who have had COVID-19 and an increase in blood sugar and blood pressure, those comorbidities. So we do expect to see, coming out of this pandemic, an increase in those non-communicable diseases as a result of persons being infected by COVID-19. So we have to strengthen those areas. So our health system continues to grow from strength to strength as we move forward. And while we acknowledge that we are on the other side of this pandemic, the battle isn't over. The healthcare is a never-ending battle. There was another part of... Yes, Nancy, the ethics committee, there always is. Remember, when you bring a patient to casualty, or God forbid there is a mass casualty event, a bus, there's something called triaging that our doctors always do. They deal with the most vulnerable, the most critical first, as best as possible. They use their medical professional knowledge there. Thankfully, we never got to a situation where we had to choose who got a hospital bed, because we always had beds available for those who needed it. And that is a testimony to the professionalism, the strength, and the preparedness of our healthcare system as best as possible with all of our limited resources. So there was never a need for it. And I'm glad to say that right now, I don't see that there's ever going to be a need for asking healthcare professionals to decide who gets a bed or so, and having somebody else or a group of other people together with them to give them a certain amount of moral or ethical guidance on that. We didn't get there. Some countries did. Some first world nations did. We did not get there. One of the reasons I do believe we did not get there is because we recognized that possibility. We put certain systems in place, and we had that discussion. And we had that discussion publicly as well. And I think that's why we never got there, because we recognized it as being a possibility, and we did what we had to do to prevent it from being a reality.
Thank you very much. GVN, you have the final question, and we'll wrap up this segment. Go ahead, please.
Yes, Minister, for a question, sorry, for the Minister. I'm not too sure if you'll be able to answer whether from a government or Ministry of Health standpoint. However, there are reports that the sewage system at Lakalum, the issues there is again resurfacing. Is government or even the Ministry of Health aware of the situation?
Well, we are all one entity, the government of Grenada, but from a health standpoint, I have not received any information, but I will most definitely follow up, because always where there's smoke, there's possibly fire. So I will reach out to my colleague minister in housing, and also to our environmental health division and NAWASA, for us to get on top of the situation and make sure that if there is an issue there that has resurfaced, that it is remedied or dealt with as quickly as possible. So I thank you for bringing that up. But no, I am not aware of any issue with Lakalum, but we will follow up.
Colleagues, thank you very much. So, as mentioned, we still have to come the Minister for Finance, Economic Development, Physical Development and Energy, the Honorable Gregory Bowen, as well as the Permanent Secretary, Mike Sylvester. So we have final words now. PS, we start with you, and then the Minister will have the final word.
Right. So in closing, I would just like to make an appeal to everyone. The thing is, Grenada is one small place. When things are good, we all celebrate together. When things are not so good, we all suffer together. What we want to encourage everyone is to act responsibly, and let us continue to ensure that the state that we are seeing with regards to very low levels of cases continues. All right, we know that we are approaching a time of the year when there are many activities. We want persons just to remember that as they go about their daily activities. Thank you.
Thank you, CMO. Minister, final words.
We have come a long way. We've come a long way as a team. We've come a long way as a nation. And the successes that we have achieved have come with unity. It has come with us recognizing what the threats were, speaking as one people, and marching in one line, taking the necessary sacrifices, making the necessary sacrifices. Out of this, though, I really do want us all to recognize that while we are here because of our own individual responsibility, personal responsibility and sacrifice, there are many out there who went above and beyond. When we were restricted to being home and maybe going stir crazy or so at home, there were others out there keeping the peace, keeping the health systems working and all of our other systems working, our essential workers in general, that we recognized in December and January of this year with our budget. But I think as a people, let's spend between now and April 4th, if and when we interact or pass our nurse, doctor, police officer, essential worker, sanitary worker, port worker, all of those that we have recognized, NAWASA, all of those who kept systems working, and say thank you for getting us there, because they are our neighbors too. And like I said, while some of us were home going stir crazy, they were out there keeping us safe and keeping things moving. But in particular, our healthcare workers at our various healthcare facilities, General Hospital, Princess Royal, and Princess Alice Hospital in particular, who are on the front lines, who dealt with, who saw, who treated the 217 Grenadians who succumbed to COVID-19 and who were there, and who need that pat on the back and that hug and that smile from us now, simply saying thank you. And we cannot imagine what it is that you went through, but you went through a lot, and we appreciate it.
Thank you very much, Minister for Health and Social Security, the Honorable Nicholas Steele, as well as the Chief Medical Officer, Dr.
President, one more thing I just want to add. As we remove these restrictions, it's been very contentious. Many of us have been very emotional based on what side of the fence or what side of the various positions we stood. With respect to vaccine, with respect to the wearing of the mask, with respect to social distancing, etc., even with respect to the implementation of the state of emergency. All of this, in my opinion, come April 4th, based on the current trajectory, is behind us, past us. And we still now must find a way, hopefully, to interact and move forward without the various differentiations that COVID-19 has caused. So I look forward to all of us, those of us who need to, make peace with your neighbor, your friend, your co-worker, and let us move forward without any of the various restrictions, banter, or reasons to look at each other differently come April 4th. Thank you.
Thank you very much, gentlemen, colleagues, and viewers. As mentioned, we still have officials from the Ministry of Finance to come, so we take a quick break and we will be right back.
Dreaming of taking a break and escaping to an idyllic, happy place? Well, finding it does not require you to go too far. You already live in paradise. All it takes is for you to go out and discover it. Grenada, Carriacou, and Petite Martinique are blessed with a wide variety of accommodation that satisfy any taste and budget. Find the one that suits you and your family and treat yourself while having peace of mind that your health and safety is a priority. Knowing that we have gorgeous waterfalls, stunning beaches, and flavorful cuisine, let's be tourists in our own islands and enjoy paradise at home.
Good morning once again, and we are back with you as promised. We have with us now the Minister for Finance, Economic and Physical Development and Energy, Gregory Bowen, the Honorable Gregory Bowen, and Permanent Secretary, Mr. Mike Sylvester. So I'll hand you over one time to the Honorable Minister. Good morning, sir.
Good morning to you, and the moderator, and to the viewing and listening public throughout Grenada, the diaspora, the region, and the rest of the world. Today, we are here to bring a sense of realization to our citizens. The fact that the Ministry of Health took the first part will always keep in focus that we are fighting a pandemic. It has not gone away. We have triumphed so far, but we must always remember that we are still in the period of uncertainty. This is why the Ministry of Finance, acting on behalf of the entire government of Grenada, has decided that we must come to raise the awareness of our people to recent happenings throughout the world and how it will affect us in particular, because we are dealing with Grenada, but I'm sure other countries will do this and will make the citizens be more aware of where we are. In particular, what is going on between Russia and Ukraine and Europe and the US. Because you need not have a physical battle to change the prices on the market. It is how people perceive the powers will operate or will take actions in the future. In that context, therefore, we want to remind you that the international fuel prices has become acutely elevated since 2021, the end of 2021 to 2022. The government of Grenada has decided to cap the price of fuel at $15. So today I will give you an idea, we have been given it in the price changes, of what has been happening with the $15 cap. And with the rise in price of fuel, when it was capped, it was in the $79 region per barrel. And now it is in the 110 region. This morning we heard that it went down a little bit because of some arrangement, but that's volatile. It will go back up very soon. What therefore will happen to our fuel prices? Capped at $15, and let us look at our projection. In December 2021, $16 average is the real price. January 22, 1686. And February, 1771. March, the real price will be 1941. April, 1909. May, and remember, we're saying April and May 2022, these are only projection based on the international community and the powers to be, like the U.S. Energy Division, etc., Energy Department. So I would not call the rest because these are projection. What we must look at is the March figure of 1941 compared to February of 1771. It shows a massive jump. And if we continue to jump like this, with a terrible happening in the Ukraine, while we say April and May will be down 18, they could be 20. So our intention is to come to the general public and to tell them what is happening in the world and the expectation, what Grenada will have to do. We have a $5.50 fuel tax. Now, if we keep it pegged at 15, remember, then all that tax will be eaten up when the price becomes $20.50. You take $5.50 out. And we could reach that in a month or two very easily. So we collect no taxes. In other words, all the tax we collect, we give back to the importers because they have to pay a higher price for the fuel. And then we will go past the stage of no fuel taxes and be dipping into another tax type. For example, personal income tax or environmental levy. If we keep the price at 15, we'll therefore dip into those in order to maintain that. So this is not prudent management. We have come from a situation where our buffer has been reduced significantly because of all that we have been doing during the COVID time to help our people. So you will be there with us as we make the decisions. Now the total tax out of the $5.50 for the year we're looking at, and that's a good projection, will be something like $28 million that we'll be giving up, taxes collected and given back to the importers to pay for the fuel. But in general, if we look at a different scenario, we could expect to give up $71 million at a higher level scenario. If the prices go to $21 and $22, if we remain at the $15. So we have options facing us. Increase the cap, go from 15 to 16 to 17, and God forbid we do not want to have to bring it to 18 or 19. We are showing you the scenarios before us. We hope God will bless us like in the COVID time. We did not want the double whammy of a hurricane and the virus. We did not get that. So we hope that the prayers around the world will bring peace and we'll get a price for fuel, increasing a bit yet, but within our limit, that even if we use up all our $5.50 per a gallon on taxes, we'll be able to keep a cap, if not 15, maybe 16. It could reach 17. What we're doing today is to raise the awareness of people of what is to come. Prices again on other items. Everyone knows wheat and wheat products. The bulk will come from that particular area, Russia, Ukraine, around there. What will happen to these products and to the byproducts that they make? We expect prices to go up. And with the price of fuel going up, then shipment costs. Shipping will go up. And in general, you'll have inflation and prices will go up and up. So while prices are going up, we are taking from one tax type to subsidize another tax type. We're not saying that is not necessary, because you could see the economy moving with a cap at $15. Our duty today is not to give you too much details, but it's to raise your awareness. So we have some details here. I've given you some with respect to fuel, electricity price. Remember, what we touched was a non-fuel price. So they'll have to pass on the increase in prices. Last year, it went from 48 cents per kilowatt hour on the fuel price up to 52, so it's climbing. And we expect it to reach as much as 58 cents per kilowatt hour in the dismal scenario. And I shouldn't say too dismal. Dismal is going up a bit. If it's real dismal, it could go way up to the 60s. So, fellow citizens, let us focus, let us bring our minds into this, and let us work together so that when the change comes, if it is negative, that we are all prepared. I let the Permanent Secretary through, Madam Moderator, to perhaps look at the items and how we see them increasing in cost. And then we'll want to give a scenario of how we think we'll address the situations. Thank you.
Thank you, Honorable Minister. PS, the floor is yours now.
Thank you. Thank you, Madam Moderator. Thank you, Minister. And let me say good morning to members of the media and also to the viewing and listening public, including those who are joining us via the social media platforms. Just to underscore some of the points that Minister would have raised, and to zero in particular on the whole issue of the food prices. We have to be mindful that the high and rising food prices that we are experiencing now predates the Russian invasion of Ukraine, which started in late February. This was driven in particular by increasing demands in advanced and emerging economies. We know, for example, some of the economies, China and other economies, were basically starting to recover very strongly. And of course, the demand there would have driven the price of food and fuel in particular. And of course, we also had what is referred to as COVID-induced supply chain disruptions. All those impacts were affecting the price of food and fuel. As the Minister would have announced in his budget speech, there were several measures that were announced to sort of mitigate the impact of this, and all of those measures have been implemented, and we are, of course, continuing to monitor the impact. And as the Minister would have said, we're seeing some kind of spillover effect in terms of economic activity, which is very, very good. We are now faced with a much bigger shock in terms of the Russian invasion in Ukraine, and of course that is generating very significant headwinds in terms and risk to the economy. And chief among them is the inflationary impact. So Minister would have already discussed in detail the impact on fuel. In terms of food, the fighting that is taking place, of course, is taking place in the fertile Black Sea region that we have, and of course, by that happening, we know that some of these countries are in that area is really the breadbasket of some of the food that we consume on a daily basis, wheat in particular. And of course, that will have a significant impact on the price. We have seen the price of a bushel of wheat, for example, would have increased from around $800 and something dollars to over $1,002 in March. And there are continuing pressures, of course, on those prices, including from what is considered as shortages or fears of shortages and so on. And so you have those issues driving up food prices. Like fuel, these prices will reach us. Of course, we are price takers. We have no say in determining how these prices go, and of course we import almost all of our products. In fact, we import over $6 million in terms of wheat product every year, and that goes into baking, into our cooking, and many of the other byproducts out of that. And as a result of that, we do expect to see a significant increase in these prices domestically. Take for example, we what we consider the 2-pound bag of flour now, say baking flour, that is now what, 360 something cents, $3.67, sorry. We also have the cooking, which is about $3.80. And that is before we're talking about today's price. You know, we see that those prices increasing significantly. In fact, if we were to use our projected inflation rate for this year, we will see those prices moving up by more than $1 in terms of the baking flour and cooking flour. If we were to use the U.S. inflation rate, which is much higher than in Grenada's, and if we were to use that, and of course, as I said, most of our products we import from the United States. Most of our wheat product consuming we import from the United States, we could see that figure more than doubling in terms of the price of flour and so on. So that is something for us to continue to monitor. I mean, it's a real shock, and it will be a real shock to the economy given how widely we consume these products here. Government would have already removed the VAT on some of these basic items. Many of these basic items are also price monitored, so they are part of the products that the consumer price, that's the consumer price statistics, and consumer price affairs. Those are the products that they monitor. And so even if you monitor, what is monitored is really the margin, and to the extent that the price at the base is increasing, you may see those increases in those prices. So we have to find creative ways to see how we can mitigate some of the impact. We have discussed intensively with the IMF when they were last year in terms of, you know, how can we mitigate that, whether we do direct transfers to some of the groups that are affected mostly, or we find some other way. And so we are looking at those areas, we are monitoring, and of course, as we go along, we will make recommendations in terms of what areas that can be implemented to be able to mitigate the rising impact of food and fuel. But it's a serious problem, it's a serious concern, and to the extent that these prices escalate, they can have a real drag on the economy. I'll stop here.
Thank you very much, PS. Colleagues, you've heard from the Honourable Minister as well as the Permanent Secretary. Anybody ready with their questions?
Good morning, Leslie and Calistro.
Good morning.
Good morning. Minister, with it capping the fuel price, what would be the result if the government decides to cut the taxes rather than capping? What kind of scenario are we looking at?
Thank you for your question. Well, de facto, we are cutting the taxes. For example, when the price is capped at $15, and the real fuel price is $18, and that too include the taxes, you have to take $3 out of the taxes projected in the budget, as the PS said. You've got to take that off the tax, and that is how we subsidize it. The base concern now is that the price will rise significantly. 15, if the tax is $5.50, and the real price, including tax, is $20.50, that means you collect zero tax. You have removed the taxes in order for it to be sold at $15. But if, with the $5.50 scenario tax that we have presently, the real price goes up to $22. If for you to cap it at 15, you have to find $7. $5.50 from the tax, so no tax. You have removed that. Plus, you have to find another 150, but you must take that from another tax type. I've only called environmental levy, I've only called C, corporate income tax, or personal income tax, or something else. In other words, there'll be no more petrol tax off the book. So we are de facto reducing it. So I think your question could be, and I want to zero in on the point where the external environment has caused the price to escalate past the 550 we have in taxes, so that we have given up all of this. And the next step, as you would see economically and otherwise, we lift the limit so that you do not go into another tax type. Because this is what we projected in our budget to the world and to you. That's what we need to do other services. So even if we say, well, petrol, we get nothing from petrol coming into Grenada again. That's good, but get that 550, but it's there to do something. No, we don't have it anymore. We'll have to dip into another one, which we would not have anymore. Our buffers went down. We have to build it back up. You see shock after shock, so do not say that we will not have another shock. So we need to manage the economy and the finances prudently to take care of what is to come. Thank you.
And
any other Calistrat?
Yes, please. Given the projections, how long will government be able to sustain the reductions that you applied to electricity and to fuel at the pump? What timeline are we looking at where government has to take corrective measures to safeguard its revenue?
So, I think, given your fair estimation, we should erode that 550 within 2 to 3 months, or we could do it in 1 month. If we hear about the possibility of nuclear technology being used, then all things will go up. So within 1 month, you can have it done, within 3 months. Then we can also say that if we make the deals we're making with certain oil-producing countries who were banished before, and if they come on stream and they can increase that supply and the fear is removed, then we will not be using all of our 550. As a matter of fact, the price could be stabilized and we might only reach 16 and come back to 15. So it's volatile out there. That is why this press conference this morning is to make Grenadians look up and see, well, yes, and always think what could happen and plan your life accordingly. Plan your expenditure accordingly. We hope that the best will come and that we will not be able, we should not have the need to raise the ceiling way above the $15 that we are today. So I hope you know that no one could predict. Nobody knew what, a month before the Ukraine invaded this, or another country might join. You hear the news that they're looking at other countries joining into the fray and the threats are being made. All of that affect oil prices and the commodity prices. Thanks.
Thank you. GBN, good morning.
Hi, good morning. In terms of solutions, it was highlighted that there are possible scenarios for solutions to alternatives, while it is expected for gas prices internationally to rise. Can you highlight or elaborate on that?
The best result will come from working together with the Caribbean community and with the powers that be in supporting arrangements throughout the world. Yes, because if we can play our part to get parties to come together so that the stock market will see that the supply of oil will not be drastically diminished. And in that context, I would not want to make any statement, at all. I know at the level of heads, and not only in the Caribbean, but working together with the international community, this is the best way to go. We ourselves could do what is necessary. Once the opening is there, we'll take advantage of it. Reducing the tax, as was said there, it's being done now. That's how we keep it capped at 15. So that is not a new option. Thank you.
If I may, just to add a footnote to that. I mean, as I said, we recently had discussions with the IMF, for example, in terms of how we can mitigate some of the impact that we are seeing now. And I mean, one of the ways you can do that is to allow the price to fluctuate. In other words, allow people to pay $21, $20, $19 at the pump. And then, of course, use that revenues to make direct transfers into individuals and groups, for example, who might most need. So, for example, you may want to increase the amount that you pay to under the seed program. You know, there are options you can use. So there are a way you can do direct transfers and allow the automatic fuel pricing mechanism, which we have. And I think most of the OECS countries also have that to be basically to function freely. So that's one option. Now, with that option, that can also have impact on the economy, because if you have very high prices, especially food and fuel, that will be a drag on economic activity. And so I think the cap, as Minister has said, where you sort of reduce the amount of take from the tax, is a solution. It's a solution, albeit it's one that is working, and also very easy to implement, in the sense that you don't need a lot of administration to actually implement that. And so I think that option is the one that's on the table, and I think that's the one that is being used at this particular time.
Thank you. Any other question from you, Gerard?
Yes. In terms of, it was highlighted that wheat products, flour, etc. But in the matter for grain, which is a major input in terms of for feed for poultry, livestock, Russia as well as Ukraine are major exporters of those. The situation with the local feed company has not been resolved, and that has been ongoing for years. The farmers are still crying out, and it may be even worse now with prices to even go skyrocketing higher because of lack of inputs for the same company to manufacture or produce feed for poultry and livestock. Is government looking at alternatives for these farmers, sectors of farmers, poultry, livestock?
Well, on the trade treaty with the rest of the region and the world, definitely we are looking there. It's not only the shortage of supply. If we cannot get these people get the grain from, yes, that region, what can we get from another region? Sure, we'll take, if we do, because that's provided for under the quoted arrangement. The big issue is when the price goes up, it is not only because they are the major producers, but everybody else. The market increases the prices, even if it will come from an area where there is no conflict. And that is the major concern. Shipping, with the price of fuel going up, will be very high. We have been looking at a scenario before us where, and again, that is everything comes from the state coffers, from your monies. If we give a figure, CIF, cost insurance freight, nobody controls the cost. And you cannot ask the people producing it, they could make their monies. Nobody controls the insurance. You cannot ask them to do it, they look at you. But if you pay the freight, whichever shipping company brings it here, you pay them. But the scenario before us is that government could say, if it costs these persons $300 for freight, in making CIF, we could take out $250 for the freight, so that the CIF value will be reduced. Not that it is correct, but it is reduced by $250. And so the rate of 30% on $250 less, that is what the importers here will have to pay. And they will pass on that to the consumers. That has been looked at, how much it can do, or whatever little it can do. At a point in time, since we could not control this and know whether the price will be passed on, then a scenario is to look at the items, and these items needed by the people are price control items. So if we tackle those price control items alone, and for them, reduce freight or put freight equal to zero, the reason behind this, or the explanation is that in 2019, if you reduce the rate significantly, you're going back to freight costs that are equivalent to 2019. So you'll be collecting lower taxes, but at the same time, you'll be collecting some taxes, and the people will get it. Now, there are always the one side and the other side. You either collect all the taxes and give it back to the people through programs like CES, the COVID Economic Stimulus Secretariat run program, and that is what you call the direct transfer, loved a lot by the economists of the world. But when you do it across the board, they don't like that. Because let us say that he is in fact rich. Rich Pierre Sylvester will be getting, as well as poor Ms. Lesion will be getting. They don't like that. But the administration of this across the board in Grenada, you say we don't have much of a difference perhaps. And that is why we could do it this way or that way. Some will criticize us, some won't. But the speed at which you can get things across the board is much better than when you pick the person, because he must have criteria to determine the need and so on. And since you must incorporate this thing very quickly, and we started through the seed program, we have some needs, but it's not as large as possible. So there we are. We are looking at all scenarios, and we have discussed this with the chambers of commerce already. And but what is coming on may see the need for us to implement it, or if things go quiet down, then there may not be that specific need.
Thank you, Minister. Colleagues, anybody else with questions? I'm getting ready to wrap up. All right, it seems as though we've exhausted all our questions. So, PS, you have the final
I have
and then we'll go to...
Hello?
Nancy, go right ahead. Nancy, are you there?
Yes, I'm here. Are you hearing me?
Yes, you have a final question. Go right ahead, please.
Thank you. I'm just following up on the grain prices issue. Has there been any discussions with the farmer groups about how you're going to deal with the increased prices? I'm thinking about bulk buying, any kind of collaboration with OECS or CARICOM partners in sourcing grains from another market. And secondly, what is our inflation rate, and what is it going to be based on the projections that you've provided over the next 2 or 3 weeks? Thank you.
I'll answer the first part of the question of the heads. I did mention before that this is something that we could tackle regionally, and I know that the heads have been discussing this. So we certainly will be hearing, of course, from the various heads in the region, including our own. The issue is, though, as I mentioned, you get grain from outside of this belt, but the market doesn't care from where it comes here. Since the price will increase in the same way, the same ratio, once the supply is cut. For example, you cut the supply of oil and gas from that region, from Russia in particular. You get from Saudi Arabia, but it's gone up still. All the market looks at is the supply and demand. So while we may go out, that will ensure that we get the grain if we go to a different place and pay more for it than another region. So we'll get it. But what we want to remind today is the price, the cost of getting it. We have different inflation rates in Grenada, and as in the US, we have been examining those in the Ministry of Finance, and I'll let the Permanent Secretary answer this one.
Yeah, thank you very much. So I think as Minister said, it doesn't matter where you where you buy the grain or the wheat. You know, it's supply and demand issues that are driving the prices. And as we said, once you have conflict in that area, that region, the breadbasket of some of those products and so on, you would have rising prices. And so that will then translate into our domestic prices here. In terms of inflation, so you know that the Central Statistics Office measures inflation on a monthly basis, and those information are public. We publish those on the website. So for last year, we saw inflation of 2.2% thereabout. That was a little higher than what we would have estimated in terms of where inflation would reach. We had estimated 1.6%. This year, based on what is happening, we would have estimated inflation to reach about 3.7%. That was before the impact of the Russia invasion in Ukraine. And so we will continue to monitor the inflation rate as we go along. It may be higher than that at the end of the year, I'm not sure. Of course, we have to see how these things develop. That being said, our baseline projections is that inflation would peak in 2022, 2023, and then go back down to its level around 2%. We have been averaging around 2% for a very long time. And I think that we believe that is our inflation rate, really, in terms of the long-term inflation rate.
Just a point.
But what is it now? What is it?
Oh, that rate could double. We cannot say what it is. That's what you always ask. But things would happen so much that it could reach 4% in the next year or so. But it would always, we believe, come back down to the normal rate.
So you said what it is now?
Yes.
I think I think I explained that this is estimated on a monthly basis. So I would not be able to tell you what it is today. You'll get it at the end of the month.
GBN, final question.
Yes, a question for either the minister or the PS. Any concerns surrounding the bipartisan bill being proposed in the US and its implications for Grenada's CBI program? And does it threaten the sustainability of the program, especially with the temporary suspension for the CBI program for Russians and Belarusians? And maybe even a final update on, a current update on Grenlec, divestment of shares. Anything new?
Well, first with the CBI program, I believe all the countries involved in CIP or CBI, how it's referred to, have decided to be very careful and to get the due diligence companies to work extremely hard to ensure that we do not make any error there. So it is not a matter of the suspension of the program. We'll continue with the program, but obviously these nationalities will go through significant investigation. And so that's why you have a halt in those areas throughout the region. With respect to Grenlec and the shares, during this time, you'll obviously not get the great set of interest that was expressed before, particularly by nationals. You do have some international companies who wish to come in and operate a purchase. And of course, the purchase price has always been an issue. Besides, what they have to do, the investment in renewable energy. I think most of them had the idea, the intention to come in and continue, as usual, just do this, take away the most benefit, but you say, yes, you can come in, you must invest, and you must do this one and the other, and you're seeing that the interest waning. But I believe after the economic period, the local people who wish to buy, of course, they have to do something else, with their funds because of the pandemic that we're in. But we expect this will pick up maybe a year or two when people see income returning into the pockets and they're looking at areas for investing. Thank you.
Thank you very much, colleagues. So we'll wrap things up here. PS, you have the final words, and then the minister.
No, well, thank you. I think the message today, as we've said, is to apprise the public of what's happening in terms of economic developments, especially on the issue of high and rising fuel prices and the impact that would have on the economy, as well as what are some of the possible permutations in terms of options that the government may take. So it's just to put the information out there. I think most persons are seeing and feeling, and so they would know what is happening outside there as well in terms of the impact of the Russian invasion on Ukraine. So it's ready to put the information out there and to make persons aware. We have to consider this in terms of whether it's a long-term shock or whether it's a temporary shock. If it, of course, is a long-term shock, then persons have to adjust behavior. If it's a short-term shock, then of course you can have measures to be able to mitigate that in the short term. So that's basically the message from my end. Thank you.
Thank you, PS. Minister, final words.
Thank you. I want to remind us that in December, the price of a barrel of oil was $77 US. That's crude. And look at what we paid then in electricity rates, and look at what we paid at the pump. Now in March 9th, it went as high as $179 per barrel. Yes, it has fallen because of supply and demand, with other countries who are not involved in the production of oil now getting a green light to say, go ahead, and immediately the market say, well, since the price will come up, it will drop. So it's down from 129 to 110 to 105. Hopefully we'll do the same. I think we'll use these opportunities, the region, with bilaterals and other arrangements to see how we can get the best for our people. And in general, I want to reiterate that we could soon reach the stage where the price of oil could be high and the local price at the fuel pump station could cross. It is 1950 now. It could reach 2050. At that point, when we will have given up all the taxes, then we have to do something. So keep that in mind. The longer it remains there, maybe the longer we'll take just to keep it at the 15. But we may have to go up to 16, we may have to go up to 17. So let us keep our attention focused on what could happen in this region. It is all volatile. We don't know. The developed nations don't know. And we just pray to God that things will stabilize and the countries around the world will not be affected in the most dismal way. Thank you very much.
Thank you very much, Honourable Minister for Finance, Economic and Physical Development and Energy, Gregory Bowen, as well as Permanent Secretary Mike Sylvester. And thank you, colleagues, to all of you who joined us via Zoom and asked your questions, as well as to the viewers on Channel 22 of Facebook page, YouTube channel, and those of you in the diaspora. Thank you so much for joining us this morning. Here's where we end for today. Have a blessed day, everybody. We'll see you again next week.